Hello to everyone. I'm Jasna Karacic, health diplomacy expert, head of International Council of the Patient Ombudsman, and researcher on the University of Split Faculty of Medicine in Croatia. In this presentation, I will talk about effect of limitation access to the healthcare on a pregnant woman during COVID-19 pandemic. Now is almost 1 year past that hospitals are in lockdown. We're dealing with a difficult time for health professionals who have to balance the fear about their own safety by providing full care to the pregnant woman. In clinical settings, we know that the most common patient right across the globe is the right of access to the health care. As the COVID-19 pandemic increases the numbers of the patients flowing into the hospitals with respiratory symptoms, health professionals are being extra careful about medical consultation for outpatients. And many inpatients are released from the hospitals as well in order to protect them from infection. Global decisions have been made around the world to stop follow-up the chronic patients. This presents ethical and moral dilemmas to health professionals who must choose between providing care or postponing already scheduled diagnostic and therapy process. But what about a pregnant woman? Is that possible? Absolutely no. Appropriate health information seeking behavior can play an effective role in self-care and promotion of women's quality of life during the pregnancy. Appropriate care is required during this period for prevention. Most causes of maternal morbidity and mortality can be prevented by giving prompt treatments to the woman by qualified health practitioners. Why we have then delays in maternal health services? Movement restrictions, transport challenges, and anxiety over possibly being exposed to coronavirus are acting as barriers to women who are trying to access maternal health care during the pandemic. United Nations Population Fund ran a model to assess the probable effect of COVID-19 on sexual and reproductive health services, including 3 indicators, namely births assisted by skilled health care providers, institutional delivery, and access to the contraception. Then we have a delay in decision to seek health care. Pregnant women are reported to have experienced increased anxiety as a result of COVID-19 pandemic. Then we have delay in reaching the health facility because the lockdown and movement restrictions has caused difficulty for many pregnant women in reaching healthcare facilities. Pregnant women face problems in seeking care for their newborns due to movement restrictions and distant pharmacies. There are reports also of pregnant women delivering on the road in ambulances en route to the hospital because of blockades amid the lockdown and delays of ambulance service. Next is delay in getting care. Even the women who managed to reach health facilities have reported not receiving timely care. Additionally, a lack of preparedness of health institutions appears to be another factor that hinders service delivery in many countries. With rising number of COVID-19 patients and shortages of personal protective equipment, health workers are frightened, stressed, and demoralized. Following this, we have, of course, the consequences of poor maternal health services. Decreased access and utilization can have consequences for both women and newborns. Without regular checkup, there are chances of certain danger signs going unidentified, which makes them vulnerable to complications related to pregnancy and childbirth. Which efforts are important to enhancing maternal health services? Despite these circumstances, efforts have been made to boost maternal health in both developed and developing countries. Various information, education, and communication materials have been produced to raise awareness regarding protections of mother and child during COVID-19. Here we're facing with a huge dilemma. As cases of COVID-19 continue to rise in Europe, so is the pressure for expectant mothers to wear masks during labor and even delivery. While medical teams say they need to protect themselves, some new mothers are sharing their traumatic stories about wearing masks and denounce a form of obstetric violence. We have a growing complaints about new understanding and protocols where no fathers allowed in delivery rooms. In conclusions, the COVID-19 pandemic took the world by surprise. It has caused disruptions of health services on the global scale. Various modalities used to combat the infections have exacerbated the delays in access to the healthcare, including the delays in decision to seek health services, reaching health facilities, and getting required care. What the COVID-19 pandemic has taught us is that the health preparedness is necessary for dealing with unprecedented situations in the future. The recommendations are directed that special attention should be given to vulnerable people like pregnant women and newborns while planning for such events. Effective preventive and clinical strategies are needed to control COVID-19 infections among pregnant women and lactating mothers. Governments also need to make sure that women can access basic information to protect the health of themselves and their babies. The last but not least, take home a message that understanding the needs of each individual woman locally brings together the best outcome of care and establish a stronger relationship of trust between patients and health workers. Thank you very much for your attention, and here is the link where you can find more information.